Okay, hello everybody. Thank you again for joining us today. I know some of you might be on your lunch break, so please feel free to be eating and enjoying your lunch as I go through the presentation. We will start with the presentation and then we'll have time at the end for some questions or any discussion as well. If you have questions during the presentation, if you want to share them, you can put them in the chat. We have somebody monitoring that. Otherwise, at the end, you'll be able to raise your virtual hand and ask your question out loud if you prefer that. Okay. All right, so I'm going to share my screen and get started. Disappear. All right, great. Welcome. My name is Caitlin Starr. I'm the Assistant Director in the Office of Diversity, Inclusion, and Community Relations. This disparity report was undertaken as a result of a warrant article that passed town meeting in November of 2020. The warrant article urged the town to reconcile gaps and disparities through direct budgeting by identifying the unmet or undermet needs of historically underrepresented communities in Brookline, primarily residents of color, low-income residents, residents with disabilities, and aging residents. To identify those needs, the town needed to gather data from various town departments and community organizations and establish a baseline of services that were available, as well as identifying the gaps in where those services were. The disparity report is a result of that effort and reflects both the qualitative and quantitative data that was available within the municipality and community organizations, as well as community-wide perspectives that were gathered during a survey and several forums. The working group and key contributors and stakeholders that met over the course of a little more than a year now were representatives from our office, Mutual Aid Brookline, Building a Better Brookline, the Council on Aging, Brookline Housing Authority, Brookline Public Schools, variety of Brookline town departments, several commissions and committees, Steps to Success, Teen Center, Brookline Adult Education, the Brookline Asian American Family Network, the Food Pantry, the Brookline Center, and Women Thriving, Inc., just to name a few of the key stakeholders that we met with. According to 2020 census data, there are 63,191 residents in Brookline. 63.7% identify as white, 18.3% identify as Asian American or Pacific Islander, 6.5% identify as Latinx, 3.1% identify as Black or African American, and 8.1% of residents identify as two or more. Excuse me. The poverty rate in Brookline is 12.25%. 21% of our population is over the age of 60. 29.1% are foreign born. 3.5% of residents under the age of 65 have a disability. When we look at insurance, health insurance, 2.36% of Brookline is uninsured. 6.12% rely on Medicaid, and 11.2% rely on Medicare. So we identified 14 disparities to begin with. They were access to technology, access and availability to COVID-19 testing and vaccination, access to food, educational access and achievement, employment, housing status and affordability, health disparities, mental health and substance use, quality of life, access to adequate transportation, public safety services, language access, childcare, and universal access design. We've added a 15th disparity, lack of representation in town government and engagement, thanks to some community input, and we will address that at the end. So before reviewing the data, I do want to address that for most of the disparity measures, we were not able to retrieve quantitative racial demographic data. The report addresses disparities through the lens across all underrepresented communities. However, nationally, we know that a disproportionate number of BIPOC communities are impacted by these disparities. And based on the qualitative data and narratives that we gathered during this process, we know these trends to be true here in Brookline. We do know that 51.5% of Brookline's residents who do live below the poverty line identify as BIPOC. Many of the disparities that the working group examined are systemic in nature and are interconnected and interdependent in many ways. The working group identified 5 broad overarching recommendations based on the key findings, narratives, and the specific recommendations that are addressed in the report. These 5 broad overarching recommendations are: 1, a townwide commitment to addressing systemic barriers and redesigning the systems themselves to fix current disparities and prevent future ones. 2, the creation of a Town of Brookline Social Services Department as a means to create synergies and coordination of community resources. 3, the town needs to prioritize equitable communication for all town services, government, and events. 4, ensure that all community members have access to all aspects of public safety, including emergency response, mental health services, and proactive and preventative health programs. And finally, commit to finding ways to make Brookline more affordable through housing, education, employment, childcare, which would improve the overall quality of life of all residents. Ensuring Brookline's educational and childcare programs expand and adapt with the needs of a growing and more diverse population. Okay, so now we're going to move on to our key data and recommendations. This is not every data point and every recommendation that is in the disparity report. Liz, if you wouldn't mind putting a link to our disparity report webpage where people can find the full current report, as well as a copy of this presentation and all of the data that was collected from the survey, as well as from other stakeholders, that would be great. Okay. All right, so close that out. Okay, so we're going to start with access to technology. A phone and paper survey was conducted by a third party at BHA's elderly properties with a response rate of about 50%. At Kickham, 12% of respondents had no technology devices and 12% did not have Wi-Fi or internet. At Colonel Floyd, 27% of respondents did not have a technology device, 31% had no Wi-Fi or internet. And at Morse, that number was 30% of no technology devices and 32.5% of no Wi-Fi. The library reported approximately 500 uses of the library public Wi-Fi network outside of the building during an 8-week period from December 2020 to February 2021. A Tech Buddies program, these numbers are as of the end of January of 2022. 60 eligible residents had qualified for the Tech Buddies program. 27 needed both a tablet and internet. 27 needed a tablet only, and 2 needed internet access only. 40.4% of respondents are living at BHA, and 57.1% are not living at BHA, but are on a public assistance program. So to address some of the conversations and data we had around access to technology, some of the working group's key recommendations are to provide additional annual funding to allow for sustainable support of the Tech Buddies program, to assist the Public Library of Brookline with community communications about the resources they have available and increase utilization of those resources, provide communications in several languages, and identify town support to ensure that residents in need have access to federal programs such as Lifeline and the emergency broadband benefit. Ensure that post-COVID-19 in-person meeting rooms throughout the town have the proper technology and tools to allow for simultaneous remote access participation. And lastly, to monitor planned obsolescence, particularly in communications and medical devices, and work with residents to ensure technological shutdowns are not impacting access to services. Next, we look at food access. Some data that we collected around food access was since March of 2020, the Brookline Food Pantry is serving between 600 and 700 families a week. Prior to the pandemic, this number was closer to 150 to 175 families. There are currently 170 families in a food delivery service for seniors and residents with health concerns. Brookline Thrives is distributing about 500 bags per week. The Brookline Public Schools provided 280,000 meals, both breakfast and lunch, to families in the district over the last school year, both in school and at the mobile sites. The district has seen a 3% increase in free and reduced meal eligibility in the 2020-2021 school year. This is compared to a typical annual increase of approximately 0.5%. Springwell has provided 17,340 home delivered and take-home meals to BHA residents. Mutual Aid Brookline has made 1,741 deliveries and distributed $127,779. 478 separate households registered and received coupons for the farmers market through the health department this past summer. Okay, so some of the recommendations that the working group came up with for food to address food access was a designated town social services human service staff person dedicated to addressing food insecurity and ensuring continuity and sustainability of local food resources. This could look like quarterly communication with Brookline's low-income residents, senior residents, and other vulnerable residents to assess and ensure that they are receiving adequate services and that gaps in need are being addressed. Develop a comprehensive, centralized resource available in several languages, made easily accessible both electronically and in print. Emphasize the continued need for alternative means of acquiring food, such as deliveries, curbside pickup, etc., and provide incentives to local businesses to continue to provide these services. A town commitment of non-emergency funds to the Brookline Food Pantry, and to work with food insecure residents to determine what would be most useful to them, including farmers market coupons without income or disability verification, with more flexible pickup and delivery times. When we look at health disparities, the numbers here specifically are related to COVID-19. COVID-19 case data has been collected from March 2020 through January 21st, 2022 by the Brookline Health Department. It was noted that approximately 80% of Brookline cases have known race ethnicity data available, and the proportion of burden has had a greater impact on the BIPOC community in Brookline. Several recommendations that the working group is making is to fully staff the health department, more widely publicize future COVID vaccine clinics and testing dates, use digital and print means to ensure all Brookline residents are receiving the latest COVID testing and vaccine information, ensure that all data is considered in relation to the latest census and population numbers, particularly in relation to race, ethnicity, age, and sex, publish monthly updates of Brookline public health data, including COVID, on a publicly viewable health dashboard, staffing and funding for proactive and preventative health programs such as blood pressure clinics, nursing programs, or diabetes care, and that all health alerts and messages are made available to all residents in various media and multiple languages. Next, we look at language access. According to a 2019 data from the US Census Bureau, nearly 30% of Brookline residents are foreign born. About 10% of the population are limited English proficient. According to the Office of English Learner Education, they provide service to more than 850 students in grades pre-K through 12. They received a total of 445 requests from July 1st, 2020 through May 1st, 2021. The district's annual allotted budget for language access is roughly $70,000 to $85,000 a year, but they report that the actual need is roughly closer to $100,000+ a year. BHA reports that an estimated 15% of Brookline Housing Authority residents speak a language other than English in the home. And based off of narratives and other qualitative data that we receive from the library, from BHA, the Office of English Learner Education, and other departments, the top languages spoken in Brookline, aside from English, are Mandarin and Cantonese, Japanese, Spanish, Korean, Russian, Portuguese, Vietnamese, Hebrew, and Haitian Creole. The working group's recommendation included performing a 4-point analysis of language needs in Brookline and develop a language access policy, hire a language access coordinator for the town, have ASL interpreters contracted for the town. Language access should be a line item on each department's budget. For reference, the BPS budget for language access is roughly $100,000. Better marketing on how to request or access language service through the town. And each town department should ensure that their PDFs are posted to the website has optical character recognition so that attached PDFs can be translated. For education, 6,891 students were enrolled in the Brookline Public Schools for the 2020-2021 school year. When we look at demographics of the full public school of Brookline district compared to Steps to Success students, 48% of STEP students are on an IEP compared to 16% in the total district. 40% of Steps to Success students are medical alert compared to 22% in the overall district. 63% of STEP students are economically disadvantaged compared to 9% in the overall Brookline district. 79% of STEP students are on a free or reduced lunch compared to 11% overall. And 87% of STEP students are students of color compared to 47% of the district overall. The spring 2021 MCAS data shows that 78% of white Brookline students in grades 3 through 8 met or exceeded expectations on the English language arts test, compared to only 32% of Black students. The gap for the math MCAS test was slightly higher, at 68% of white students meeting or exceeding expectations compared to 17% of Black students. Several recommendations that the working group made is comprehensive publicity of financial aid availability for standardized testing, sports and after-school activities with added costs and electives with added costs, school committee or a PSB committee to analyze recent MCAS disparities data in connection with other school disparities to ensure a holistic approach to addressing educational disparities within Brookline. An active discussion with students impacted by the MCAS disparities to understand and implement resources that would be most helpful for students and their households. And an annual public report on how public schools are mitigating established disparities. Employment. As I mentioned in the beginning, 12.3% of Brookline lives below the poverty line. As of January 2020, the town of Brookline had 696 full-time employees. 28% were female, 79% were white, 9% Black or African American, 5% Asian or Asian American, 5% Hispanic or Latinx, and 1% other. Beginning in 2021, the Brookline Housing Authority launched the Self-Sufficiency Program to provide economic mobility coaching for state public housing residents. Several recommendations include creating a Brookline Jobs Board or annual job fair for all Brookline-based employers, creating a town-wide teen employment initiative, including a funded position based in the Teen Center to run a teens job hotline or job board and connect with employers throughout Brookline and Boston. Town of Brookline to increase the pay for internships to make these opportunities more equitable. Actively advocate for more accessible workspaces in Brookline. The Office of Diversity, Inclusion, and Community Relations, as well as Human Resources, collaborate to set up employee resource groups. Town of Brookline allow for more remote employment opportunities to encourage qualified candidates to apply for those positions. And lastly, town meeting to consider passing paid family and medical leave for town employees. Looking at housing status and affordability, 29% of Brookline residents have low or moderate income. 48.9% own their home and 51.1% rent. 47% of renters spend more than 30% of their income on housing, while 23% of renters spend more than 50% of their income on housing. Waiting lists for subsidized units are often 2 to 10 years long. Only 26.7% of mobile vouchers that are issued through the Brookline Housing Authority are actually utilized in Brookline because of the high cost of rent. The safety net has seen a 129% increase in housing need assistance between 2020 and 2021. Several recommendations included consider zoning reform that would allow density bonuses for increased inclusionary units, reconsider rent control as a town measure to stabilize the proportion of income Brookline residents spend on monthly rent, open a town fund or match Brookline Center funds for use towards rent for residents who are at risk of eviction, assist in providing funding to Brookline Housing Authority to renovate state public housing kitchens and convert to all electric appliances. This would reduce instances of asthma, reduce fire safety issues, improve greenhouse gas emission output, and allow Brookline's neediest families to have a modern and appropriate set of appliances to cook healthy food, helping to mitigate nutrition and health disparities. Lastly, funding the property tax and rental relief programs through the senior center and expand to include more residents. When we look at childcare, BEEP has a current enrollment of 296 students as of November 2021. 42 students are currently receiving full tuition assistance. However, there's a wait list of at least 25 families that are eligible for tuition assistance but not receiving it. Parent Child Plus has a 2-year program that serves 20 families a year, and there is a wait list and tremendous need in the Brookline community. The Special Education Parents Advisory Council conducted a survey, and they learned that 77% of respondents identified that they do not have adequate childcare for their child with a disability, and 54% of respondents cited a significant increase in cost as a barrier. We also identified there was a severe lack of affordable and available after-school options, specifically for Steps to Success families from kindergarten to 3rd grade. Several recommendations include expanding publicly accessible programs down to K-8 for out-of-school time, providing a fully funded pre-K/BEEP, identify and create an updated and centralized list of childcare options in Brookline, as well as easily accessible guidance on how to identify eligibility and access available resources. Provide expansion funding for Parent Child Plus. Lastly, transportation. Some data from the Brookline Senior Center includes total subsidized transportation participants over the last year is 330. Percentage of these participants who are low or moderate income is 82%. There was a total of 1,022 subsidized transportation rides from July through October of 2021. There's an average of 340 van rides per month and approximately 200 meals delivered per month. Several recommendations include recognizing all modes of transportation in future redesign projects, increase the safety and use of sidewalks and crosswalks with well-painted markings, pedestrian-friendly lighting as new projects are being developed, an accessible public town bus or vehicle, whether through the Vets Department, the Office of Diversity Inclusion, or the Senior Center, increased bus service to South Brookline, ensure new Fisher Hill low-income senior housing is linked to adequate transportation, and increase funding for the Senior Center and the TRIPS program to make transportation programs sustainable. Okay, so as I mentioned at the very beginning, community feedback received after the initial release of the final report 2 weeks ago identified that the demographics of the current core working group embodied a key disparity in Brookline, the lack of representation in town government and communities and general community engagement. Our current next step is working with community members to highlight the disparity of representation in town government in an updated addendum to the report, which will hopefully be released next week. We circulated a disparity report community survey in October of 2021 that was open through December. We had a total of 144 responses. 141 were in English, 2 responses were in Russian, and 1 response was in traditional Chinese. Out of our 144 respondents, 68.8% identified as white, 7.6% identified as Asian or Asian American, 4.9% identified as Latinx, 2.1% identified as Black or African American, 0.7% identified as Native American or Indigenous, and 0.7% identified as Native Hawaiian or other Pacific Islander, 4.9% identified as mixed race, and 14.6% preferred not to answer. 16% of our respondents identified as having a disability in all age categories, and 11.8% of respondents under the age of 65 identified as having a disability. When asked, do you believe racial inequities exist in Brookline? Overall, 52.78% of respondents strongly agreed that racial inequities exist in Brookline. 22.92% agreed, 7.64% were neutral, 9.03% disagreed, and 7.64% strongly disagreed that racial inequities existed in Brookline. When we look at the strongly agree respondent responses broken down by racial demographics, 55% of respondents who identified as Asian, Asian American, or Asian American mixed strongly agreed that there were racial inequities in Brookline. 100% of respondents who identified as Black or African American strongly agreed that there were inequities in Brookline. 57% of respondents who identified as Latinx or Latinx mixed strongly agreed. 60% of respondents who identified as two or more races strongly agreed. 55% of respondents who identified as white strongly agreed, and 40% of respondents who preferred not to identify their race strongly agreed. Next two slides, we have a few comparative statistics. Respondents who strongly agreed or agreed that racial inequities existed in Brookline were more than twice as likely to say yes to a centralized community center than respondents who strongly disagreed or disagreed that racial inequities existed. White respondents were nearly twice as likely than BIPOC respondents to always have money left over after paying monthly bills. BIPOC respondents were 36% more likely to rent their homes than white respondents. And white respondents were 31% more likely to own their homes. White respondents were 18% more likely than BIPOC respondents to feel confident in their ability to access affordable healthcare. Male identifying respondents were 26.9% more likely to own their home than female identifying respondents. Female respondents were 69.3% more likely to rent. Respondents who did not identify as a person with a disability were 2.5 times as likely to own their home. Respondents who identified as a person with a disability were more than 3 times as likely to rent. Okay, so again, I know this was a lot of information, and there is a lot more that can be found in the full disparity report, where again, I believe Liz put that in the chat, but you can go to the Office of Diversity, Inclusion, and Community Relations website, and everything is under the disparity report tab. And now I will open it up for questions and discussion after I stop sharing. Yeah. Okay. All right, does anybody have any questions or any thoughts after hearing all of this? No, it's a lot. I see, yes, I see your hand, Rita, go ahead.
Go
ahead,
one of your
Rita.
staff had listed the contact for the report, and it lasted 3 seconds. I need more time to write down the contact. HHTP. That's all I got.
Rita, I will send you a link in an email.
Okay, thanks.
Carla, I see your hand up.
Yeah, can I ask a couple of questions? You want to go
Yeah.
on, but okay.
Yeah.
My first one is in terms of the survey, there were 144 responses, right?
Yes.
So what what did you estimate to be the potential number of respondents? In other words, I'm trying to figure out what percentage, what percentage does 144 represent?
So we sent the survey out to probably 300 people via email. It was available in hard copy as well at the farmers market, and at the Senior Center Forum and the Brookline Housing Authority Forum. So I can't give you a specific number, but it was circulated roughly to around 400, 500 people,
Okay.
possibly more.
And that's just through the regular town channels. I will say that it also went out to a bunch of different serves and mailing lists.
Yeah.
I know we sent it out through eventually Brookline, which reaches about 1,000 folks. We always want to get as many responses as
Sure.
possible.
Sure, and that's why I was trying to, and instead of looking at the number, I was trying to figure out percentage. So, okay, so my next question is, you've got 5 overarching recommendations. Did the working group attempt to prioritize them?
No, I would say that out of all of the specific recommendations that were made throughout the report, those 5 overarching would be where we would prioritize efforts.
Okay.
But no, we did not. We wanted to put this together for town meeting members and for community members to really see where the disparities were, and be able to make decisions, vote, et cetera, based on the information that they were given.
Okay, and then my final question is your next step going to be to try and attach estimates or price tags to these efforts?
Yes, that is definitely something that we can do. We do have a list of recommended non-town funding sources in the report, at the end of the report, to help think about ways that we can find funding that is outside of the town. Some of these things won't have a specific amount listed to them. Really just more imploring the town to look at these issues, and to consider how we could address them. But yes, we can go through for some of them and put potential price tags.
Okay, thank you.
Any other questions or comments?
I would just add, for any other town meeting members on the call, the report is out, it's active. There's more than 100 pages worth of data and figures to be incorporated in any warrant articles you're submitting for this upcoming town meeting in the spring. The warrant is still open. It will be open until March 10th. So there is plenty of time to fold in this data to any of those warrant articles.
Thank you, Liz. Ryan, go ahead. You can ask your question.
Hi. First of all, thank you all for your work. It really impressed, just the thoroughness of it. I guess an open-ended question. Now that we've kind of, seen, some of the results from other efforts in town, including, I'm thinking the housing production plan, but maybe more especially like the BCN's efforts regarding the ARPA survey. I'm wondering, do any similarities or similar findings that those efforts have kind of produced stand out to the members of the working group?
Yeah, so I'll just take this first, then the working group is free to add to it. So we did collaborate with BCF in several forums, using the data that we found, starting the forum with the presentation of the data, and then going into the ARPA specific questions that BCF put together for their engagement opportunities. So yes, there is definitely a lot of things overlapping. And after hearing BCF's presentation to the select board, there are a lot of parallels. And I think a part of that is we were these two groups were working in tandem a little bit and informing one another. I mean, the answers that the community forums gave for the ARPA money helped inform some of the work that we were doing and vice versa. Joan, you're on mute.
I think that's also true for the work that was going on with the housing production plan and their efforts to, get input from the, traditionally not represented populations. So there was, I know that the ARPA stuff around housing, so there was a lot of communications going on.
I would add to that, it's not just that we're working together on these things, folks. We are seeing these disparities in the data, right? So we are answering these issues that are seen across the community. And one of the really big reasons for this report was this resolution, which was passed in the November 2020 town meeting to really put all of this in one place. So we happen to now have a wealth of data between the Disparity Report, the ARPA report, and the Housing Production Plan on these disparities that really are present in contemporary Brookline that we need to address as a town.
Thank you, Liz. John Van Squack, I see your hand.
Caitlin, thank you very much. And thank you to everybody who took part in the work behind this report. It got me thinking, were there areas that you came across where what you found is either we don't really have data that we need, or we don't have adequate data, and that we're not really sure of our data?
Yes. Is there anybody else who wants to? Go ahead, Liz.
Let me just give an example for you, John, of something that is recommended in the report to fix in the future. So we were looking at the vaccine rate data in Brookline and also in the county and statewide. And there is a tremendous undercounting of the denominator of multiracial folks, right? So we now have this amazing bucket of data from the 2020 census, which says that there is really a large proportion of folks in Brookline who identify as multiracial. But the state data from the Department of Public Health that's doing the public reporting for that denomination of COVID vaccinations, very drastically underreporting the number of multiracial folks, with the result that there is a false report that 99.95% of multiracial folks have been vaccinated. So this is taking away a statistic that might result in directing more resources to talking to multiracial communities. So that's just one example of where we know that the data itself is being formed by historical perceptions of different communities. Our communities are changing drastically, so we need to be engaging with these new demographics. We need to understand that we do need data in terms of race and ethnicity, but also in terms of allowing people to select more than one of those if we truly want to understand what's happening in our community in now the year 2022.
Thanks for that response. I just wonder, Caitlin, if, or others, if anybody else wanted to respond, if they had other, aspects of the data question they wanted to comment on. And well, I'll just leave that question in front of you, but I wanted to say one other thing as an example. And this is purely just by coincidence that there was a school committee, school finance committee meeting yesterday, at which the subject matter of the lunch program came up, and there was discussion of how much participation is there in the free reduced price lunch program. And one of the answers that came back was that the number who would qualify for it is substantially in excess of the number who actually participate in it. And it precipitated, an interesting discussion about why would people who qualify not participate. And that's an interesting discussion in and of itself. But the end result is, if the number of people participating in the lunch program were used as an indicator of need, you wouldn't necessarily be getting a true indication of need, if it's a low percentage of those who actually qualify. That's my only point.
No, and that's a great point, John. And the data that we have is what the school collected as far as who's utilizing, the number utilizing the free and reduced lunch program. So that is a really good point. And like I said at the beginning, a lot of the data we collected is qualitative and narratives. There were places where we didn't have the quantitative data, or we did, but it wasn't broken down by demographics. So we don't know too much about who's utilizing these programs, just how many people are. So yes, there are certainly gaps in what was available to us. I saw Arthur's hand and then Liz, unless Liz, you wanted to directly respond.
If you don't mind, Arthur, I do have a direct response to the comment about school meals. So yes, absolutely. The data undercounts the need for food insecurity assistance in Brookline. We've seen that in the schools. And I can say, as the delivery coordinator for Mutual Aid Brookline, I have seen that there really is just a tremendous amount of need. And there are many different groups working on it from different corners of the town, and we're still struggling to keep up. There is something that we can do about this. I am a strong proponent of universal school meals, and there is currently a bill sitting in the Joint Committee for Education in the State House that would provide school meals for all. This would mean that folks don't have to deal with the stigma of free and reduced meals, which is one of the big reasons why folks are not participating in that program. They wouldn't have to re-verify their documentation, re-verify their income every time they're applying to participate in this free and reduced school meals program. So it both saves staff time and removes this tremendous stigma of participating in really what should be a basic thing, right? Making sure kids have food. So that is a potential solution we can look toward in the future. It's something we probably want to do statewide to alleviate the burden on the town budget, but it is certainly something that is much needed.
Thank you, Liz. Okay, Arthur.
I just had to unmute myself. Good afternoon. There's something called the Report for the Committee on Urban Responsibilities, which was a report written by maybe 300 people who were residents of Brookline. That this report talked about how we could make Brookline a better place for all people to exist. There's a very small Black population in the town at that time. And the town, as an initial stage, hired the town's first Black department head, who was the department head of what was then called the Human Relations Youth Resource Commission. And that report, the report of the Committee on Urban Responsibilities, went nowhere, 1969. And it sent that Black man, who was the director of the Human Relations Commission, in circles till he finally got so frustrated that he resigned, walked away. And the town then hired Steve Bresler for the next, who knows, 20 years, however long it was that Steve retired. And I know that you can't guarantee me that this thing is going to work, that we're going to see this thing through. And you know that the criticisms that I have or had about the beginning of this initiative. But someone's got to hold someone's feet to the fire, okay, about this report and how it's really going to change the way we treat, and I'm not just going to say Black people, but people of color, Asians, Native Americans, Latino Americans, and so on and so forth. There has to be something built in, okay, that's going to stop us from going in circles. And I'm not sure, I haven't really thought about it that clearly. But let me finish by saying I got to be blunt. We've got to learn something from the Gerald Alston case. This town has to, just in terms of how we treat human beings, okay, forget the white, forget the Black, forget the Latino, how we treat human beings, how we treat their children, how we educate their children in our schools, how we hire people. All right, because again, I go back to 1969 and where we are today. There was absolutely no reason for us to have had the Gerald Alston case. None whatsoever. And we keep pushing, okay, or deluding people into believing that we're making progress by producing things like the Disparity-Report and then go absolutely nowhere. It's, and I keep saying it's wrong. You've got to change for the sake of humanity.
I agree, Arthur, and I think that you're right. A mechanism for accountability and actually utilizing this report needs to be made. I know that the recommendation is for this report to be updated. I think we put every 2 years, but looking at it after every town meeting to see if any of these issues were addressed, if any updates were made, if any more articles were passed that address these disparities. And I know it would be on our office to continue to.
Listen, I'm in a meeting, okay? I'll call you as soon as I get out in about 15 minutes, okay? Okay, all right, thank you.
It would be on our office to update and hold at least that part accountable. But you're right. I think we need to think of a mechanism to make sure that this report is not just looked at by town meeting members, but is utilized and actually informs some of the budgeting decisions that are made. I don't know exactly what that will look like, but that is something that we need to think about.
And I think the first step to that is just, everyone in the working group, everyone in town meeting, everyone in this forum right now, right, keeping eyes on this, making sure that this data is talked about, that it is utilized, then it doesn't just disappear into the void. Because yes, I definitely agree. Sometimes that happens, right? There is a report, goes on a shelf, gathers dust, and nothing happens with it. That is not the intent for this one. And I think we can all work together to make sure that that does not happen again.
Joan, did you have a response?
Yeah, I think one of the things that could help that is that becomes something written into the job description of the new town administrator. That, things like this don't just get filed, that it's that person's job. And then the select board evaluates that person based on how they're doing on getting this stuff implemented or fixed or budgeted, or if that's the place where I think something could be put into the infrastructure that would help the accountability.
Joan. Arthur, okay, I'll say Arthur, your hand. Mary Salvosi. Cebulski? Mary, did you have
Okay.
something you?
Yes, I do. I'm just trying to make make Zoom work. Hello. So I'm Mary Cebulski. I live in precinct 4. There's a few comments I just wanted to make. One is I agree that, well, first of all, the data, when you look at the school lunch data, you have the data. This is how many kids are participating in the program. But you also have the data of how many kids are eligible, because you wouldn't know that there were more eligible children than the number that are participating if you didn't have both sets of data. So I think that when you're writing a report like this, you want to include, the fact that we know the number of kids that are participating, and we know that the number of kids that are eligible is larger than that number is important, because it means the program isn't working the way it should work. That's probably the most important thing to get out of that data, rather than how many kids participate and even how many kids are eligible, but the fact that there's a discrepancy. The other thing I would say is I think universal school lunch is excellent, because I think the other thing that it will do, besides removing stigma, is if all the kids are eating the same food, the quality of the food will improve. Because there are parents who will push and say, you know what, my kids don't like this, you know what I mean? Like, if everyone is eating the same food, the food will get better. And this is a sort of something that I think when you create these silos of different communities and you cordon them off, then, I think, do people who get free lunch feel like they have a right to advocate for better or healthier food for the kids? Of course not. They feel lucky that they have free lunch at all, and that means that the program doesn't improve in that way as well. And it creates a two-tiered system. What Arthur said about the George Alston settlement, I agree and disagree with. I agree with Arthur that what happened to Mr. Alston should not have happened. But where I disagree, although I suspect Arthur would actually agree with me when he hears this, is that what happened was completely predictable. The reason that what happened occurred is because the people who were in charge, who were listening to the complaints, made the wrong decisions. I, am obviously a white person. I also know a lot of Black people, and I spent a lot of my working life as a doctor taking care of poor Black people. And what I can tell you is that when I talk to my white neighbors, some of whom were directly involved in the Alston settlement, and I hear their impression of what went on, and then I talk to my Black neighbors about the Alston settlement, and I hear their impression of what went on, I am hearing two completely, it's as if it was not even the same case. So even though it should not have happened, the fact that it did happen the way it did is completely predictable, completely. Because it happened because the group of people involved in, dealing with the complaint had a relatively uniform mindset that happened to be incorrect, that happened to be erroneous. It's not necessary. I'm not saying good, bad, race, but it just happened to be false, and in the end, we as a whole town are paying the price for that. So anyway, just a couple thoughts there.
Thank you, Mary. Carla, your hand's up.
Yeah, if it's okay, I'd like to circle back to Arthur's comments about not letting the report sit on a shelf and collect dust. And that really gets back to my question about prioritization. I think, I mean, I read this, actually, I've read this report a few times, and each time trying to absorb more of the information. And I am still stuck in terms of where do we start? And I think I wouldn't be the only town meeting member who would feel somewhat overwhelmed by the numbers of recommendations and the potential costs of those recommendations. And it goes without saying that we don't have unlimited funds. So I really think it's important, not just in terms of benefiting the people who need who need support and need help, but also for the sake of people feeling like they're making some headway, that there be at least an initial, first 3 years, what you would hope to see accomplished by town meeting, either through the budget or through other mechanisms. I mean, the recommendation or the request for or I think actually it was what you put in the executive summary, the recommendations would be for fiscal allocations and concrete actions that the town should take. And again, so people can feel that this situation isn't just so big that we don't know where to start. I think it would be really helpful to come up with, I don't know, name it, a 2-year plan, or 3-year plan, or 5-year plan, but something to make us feel like we can get going on this and actually make some measurable progress. And again, it's what you would hope to accomplish versus what actually would be accomplished during that timeframe. So thank you.
Thank you, Carla. Liz, I see your hand up.
Thank you, Carla, and we do appreciate you for reading the entire report. You're right. There is a ton. There is a lot. There are a lot of disparities in Brookline, and our reaction cannot simply be to just say, "Oh, there's too much. What do we do here?" So I have a couple of recommendations for you as a town meeting member. First, we weren't able to talk on the ground with that many of your constituents, right? So as town meeting members, what would be helpful in terms of actually using this data and looking at prioritizing these recommendations, actually talking to the constituents in your individual precinct, people that you represent, and asking them what they think. There are definitely some concrete recommendations in this report that we have made and that we do want everyone to support, including that one that came up in almost every single disparity, right? Creating a centralized social services department in Brookline. This is something that is already in the works. It is recommended by the town administrator, is recommended by the select board, but it's definitely something that we need to keep the ball rolling, because so often what we see in this report in these many different disparities is that in some cases, there are resources that folks don't know how to access. In some cases, there aren't enough resources, right? So we need to know the distinction between those two things and make sure that we are getting the adequate resources and connecting them with your constituents. So my answer is yes, we definitely want to make sure there are concrete recommendations, but we also need the help from elected officials in talking to your constituents and figuring out what's important to the folks in your precinct and what warrant articles you can bring or support or sponsor at the upcoming town meeting to really make these changes happen.
If I could just quickly respond to that, I represent precinct 13, and I have tried many times through Zoom meetings, through letters, through emails to try and get feedback on town issues from my constituents. And the concerns tend to be, people driving too fast through the neighborhood, and they're just not there. And now I've been rerouted, re-precincted, however you want to put it, to precinct 14, and I've got a whole bunch of new people that I have to meet. So I suspect you would get a more productive responses from other precincts than mine. I think there's some precincts that are going to be on top of this, but I don't think you can expect the same level of response from every precinct in town because there are a lot of differences.
Thank you, Carla. Cheryl, I saw your hand up and then Chi-Chi.
Hi, thanks. I just wanted to speak up following what Liz had spoken about a social services department in town. I would like to say that this is an important thing, I believe. I am the emergency management coordinator in the town of Brookline, working in the new Office of Emergency Management. And our office was able to get a grant for the Tech Buddies program, which is featured in this disparity report. A number of people are looking to see that Tech Buddies program move from a pilot grant-funded program to a long-term program, which I would support wholeheartedly. However, the function of the Office of Emergency Management is not social services. And although we did fight for this grant and we are putting this project, putting all of our resources behind this project, we would not continue this project beyond the grant date, which is currently ending in July of 2022. We would love to have a place to transfer it over with our lessons learned and all of the information that we have and have put together for this project. We think it's important for the town, but it's not an emergency management function to continue this program. And so I hope that there will be another place for this program to land when our grant is finished. And I support that wholeheartedly. Thank you.
Thank you, Cheryl. Chi-Chi.
Hi, thanks, Caitlin, and thank you and Sarah and the members of the working group for putting together this report and doing some really excellent research and drafting. It contains a wealth of information, and between this and the BCF ARPA community engagement, we have the data we need. So to address the issue of what's next steps and prioritization, in response to Carla's point, I mean, correct me if I'm wrong, the warrant article, the charge was to write the report, right? I think you guys have done what you were supposed to do, and it's up to those of us who are in town meeting and other parts of town government like the select board and advisory committee to figure out, okay, what do we prioritize? In terms of engaging with the community, there are ways to engage, that we have seen both through your work and BCF's work that we could try, such as focus groups and surveys. And, perhaps the next step is to ask for a follow-up committee to engage in these efforts. And also, in terms of follow-up, a lot of this will be up to individual town meeting members. As you know, I filed the warrant article to deal with some of the language access issues and got that passed. And there have been other warrant articles as well. And so it's incumbent upon us as electeds to move the agenda forward. And, in terms of residents, being more concerned about traffic going too fast on their street versus hunger and, free school lunches. I think the residents do care about that. I mean, yes, I also complain about cars going down the wrong way on our one-way street, but I'm sure in terms of values and principles, I support free school lunches and universal free school lunches, and I'm sure a lot of our community does. They just haven't been asked yet, and there are ways to do that. So thank you.
Thank you, Chi-Chi. Bonnie?
Hey, everybody. Thank you. to the working group for all of your incredibly hard work. This is such a valuable resource. I just wanted to respond to a few comments that I heard from maybe Carla Benka and others. This report, as well as the BCF's report and the housing production plan, hopefully report, will be a great tool to start deeper conversations about needs. Because you're right, people in district like yours, precincts like yours, just don't see these things. It's not in their backyard. So it's on us as elected officials to draw their attention to it. So now you have a really good tool to do this. I'd also say that you also have, you and lots of other people have a really big platform in the advisory committee to help to advocate, to move money in these directions, and to support warrant articles that move in these directions in a really powerful way. And I had another thought and now I lost it, but I think that's enough. I think this is a great tool for all of us to utilize in our writing of warrant articles and budget amendments when we don't see what we had hoped to see in our town budget showing up in line items. And to think even more beyond that, to communicating with our constituents and thinking about, reaching out to the organizations that do this work around town and saying, how can we do this as elected officials? How can we make you stronger? How can we, the other thing I was going to say is that we actually have hired a department head, not a department head, a high level person to begin assessing our social services in town, with the potential to be able to start a social services department to help in this support. And I hope that we are just handing this man these reports and saying, here, the work is done. These are the needs. You can put them all together in a sandwich and just say, here, we already did all of this. And hopefully we can start the ball rolling towards a new social services department that can be the central place to do this work. Thanks.
Thank you, Bonnie. Are there any other, Joan, go ahead.
I didn't,
Yeah.
I thought I raised my hand.
Oh, no, go ahead, Arthur.
A couple of things. One, Mary Soblowski is correct in her example of the food program, the lunch program. But you also have to apply that to the academic part of the public school system. What we really have in Brookline is a integrated, segregated public schools. Okay, you have one kind of education for white and Asian students that goes to what is it called? High achievers and higher achievers. And then there is the basic and standard. A disproportionate number of Black and Latino children go into that lower category. And then another, that second group goes to white and Asian students. Let's just disband the tracking student system. All right, that'll solve that immediately. Okay, so that all children have a chance to have an equal opportunity to get a top rate educational experience. And I think that is one of the problems that we shy away from. The second thing, very quickly, anybody who disagrees with the status quo is persona non grata. You can see the committees that are formed, created, whatever, get stacked with yes people, okay? People who agree, okay, with the status quo, with the power structure. And that's why we have year after year of the same nonsense that creates the problems that we have right now. Let's allow all voices to be heard, all voices to sit, okay, at the seat of power, not necessarily elected positions, but appointed commissions and committees that will really make changes in this town. Thank you.
Thank you, Arthur. Joan, your hand was up.
Yes, I also think we need to think of warrant articles as the beginning of a process, not the be all and end all of the process. And there have been multiple warrant articles that have been passed, but there's no follow-up. You know, town meeting doesn't dog it. And I think there needs to be a real focus on, you know, at every town meeting, looking at what were the warrant articles passed at the last town meeting and where are they now? You know, and if you did that over a couple of years, I think, you know, we would begin to see where warrant articles get passed but don't get implemented. And then what, you know, what needs to happen to push things forward. And the other thing that I think Carla has brought up is something that I know some people have been talking about, and we've been talking about it at the Community Engagement Committee, is we need to get the precincts to be active. You know, there need to be some regular precinct meetings, not just among the town meeting members, but among the people who live in the precinct of, you know, and the first couple of years, very few people will show up. But, you know, if you keep doing it, if you build an infrastructure for it, then I think you can get more people engaged. You know, I forgot who said it, but, you know, people are interested. They just, you know, you've got to sort of put it in front of their noses, you know, to start the conversation and then go deeper conversation. So I think there's a couple of things that, you know, that could happen that could make this process much more, produce more results than just, you know, reports.
Thank you, Joan. Rita, I think I see your hand up.
Yes, Joan, I just want to say that I agree very much with a lot of what Joan said, especially about bringing the information to the people in the community that we are supposed to represent, getting the information out so that many people that I talk to don't know what's going on in town. We've lost our newspaper, really. And because of COVID, but also because of everything that happened even before COVID. We weren't on the ball. We don't ask for accountability when our town meeting is open so that we know what we say at town meeting, what we've promised to do. That should be before us at town meeting, people, and we should be able to get that information out to our communities. I'm working on mine, but they just changed me from precinct 2 to precinct 17, which is part of 7, 3, and I think 10 and 2. And it's a whole new precinct with people we don't know. They don't have the names yet ready of the people we're going to represent. So there are all kinds of barriers being made. And I love the list that was made, Caitlin and group. You did a great job. And I'm thinking that number 4 was that all of the community have equal access to public safety. And I'm very involved with the Domestic Violence Roundtable, which is all but shut down in the town because we're readjusting to things in the town, and violence against women is not something that's really spoken of other than in small groups. And we're trying to keep that information open. We've been tossed out of the high school, and people, I guess, are saying, well, what are we going to do? How do we get the information out to the community? Not everybody is on the internet, as we know. Some of the most vulnerable people are not on the internet. So we have to find a way of getting into, and they're in Brookline, there's always been, I've been here since 1958, and there's always been a circling of the wagons, whether it's a school committee, the health department, the school department, again. I mean, it's very hard to get information in. And I also agree with what Arthur said, that the academic end, I know that years ago, Arthur and I had that conversation about how do you get the kids of color involved in the courses that give them the access into the colleges? How do you do that? And if the kid doesn't have the background in math or whatever is necessary to do it, do we have mentors? What do we have? What are we doing in the schools with the kids that are not coming up to par and you know that they've got the brains to do it? If they just had mentoring after school or whatever, we can do it here. We've got the people, we've got the population. So I'm just hoping that we can work together. I'm just so impressed by all of you that worked on this committee, and the findings that you made are, I don't want to say I'm impressed with those because it's really a form of guilt that I didn't do enough. But we can make up for that, I think. I really believe we're strong. Look at the women that were on here, and we're not putting you out, Arthur or John. We appreciate all that you two do, but we got to work a little bit harder. And I love the idea of getting meetings, but try and get them, you know, this programming. It's like we live in a fantasy world now, and we've got to crack through that some way. But we did it in the past, and we're doing it now in a minuscule way. This is a great, I won't say beginning, Caitlin, because you've been at it for a while. This was a great hammer. You're doing good business. And thank you for that.
Thank you, Rita. And I just want to let everybody know too, all the comments in the chat, I'm also taking note as part of this community forum to inform any other pieces of the work. So thank you. Are there any final questions or thoughts? We have another 9 minutes available. Yes, absolutely, Bonnie. I just saw your message come through. Gratitude to Deborah Brown for doing the warrant article that got the Disparity Working Group started. Absolutely. Absolutely grateful to Deborah for getting this off the ground.
Are we going to meet again?
So we had 2 community forums scheduled. This was the second one. The first one was recorded and is on our website. This one will also go up on the website. I don't know if we had a plan to do another one. We are going to be sending out, as I mentioned, the updated report with the addendum addressing lack of BIPOC representation in town government and recommendations that were discussed during that meeting. But I don't know if we're going to hold another community forum. I'm actually leaving on paternity leave after next week. So I will be doing a presentation to the select board on Tuesday, the 1st. And after that, I will not be here for several weeks.
Yes, I would encourage everyone to come to that presentation to the select board if you're interested in seeing where this is going. And we're also happy to talk to any town meeting members if you have questions about the report or if you want to use some of the data in any warrant articles for this upcoming town meeting.
I saw some reference to the disability folks and how they fit in, and I didn't jot it down, so I don't remember it, but I see Sarah Captain's name on my board. Is she there?
Yeah, I'm here, Rita.
Hi, Sarah. Sarah, was there enough information about the struggle of the disability groups because of the lack of thought or the lack of action on the part of town? Does it fit into any of the recommendations?
So there is a category called universal access design, where we talk about the need to think about physical space, communication, education from a universal access standard, which includes people with a variety of disabilities. We spoke about the lack of employment opportunities for people with disabilities and how the ADA only requires that your physical locations be accessible. They don't require that your employment side of your business be accessible, and what that does to people with disabilities and how that limits their mobility and like the financial mobility, economic mobility. And then we also reached out to the Commission on Disability, the Special Education Parents Advisory Council. I think that the voice of people with disabilities definitely was involved and informed of this report. If people feel like there is anything missing, we're happy to listen to you and fold things in, and hopefully we can continue to work on this report and have new people with new perspectives as we do it again maybe in 2 years.
Okay, thanks, Sarah.
Thank you, Sarah. All right. If there is nothing else, I did put my email and my phone number in the chat to contact me if you have any further questions or comments or feedback about the report or moving forward. If you'd like to be a part of this process in the future, we are always open and welcome for that as well. So yes, the next presentation will be at the select board meeting on March 1st. I don't have an exact time yet, but I can certainly update people who registered for the last 2 forums if they're interested. Sarah, I see your hand up.
So I just want to respond to something that Mary put in the chat. She said we need to continue to have remote access possible for all town government meetings. Warrant Article 11 was a home rule petition to continue to allow virtual access to all public meetings, but it's a home rule and it needs to be approved by the state house. I'm not sure where that is and what the process is once it did pass town meeting. And then Warrant Article 12 was about providing hybrid access to all public meetings, and that's great, but I'm still not clear if people who participate in hybrid are considered part of the initial quorum that is required in order to hold a public meeting. And would people who participate remotely be counted, or would they be counted only as additional members? And those kind of answers need to be clarified. But I do agree that remote access does allow for more access for people with disabilities for the most part, but we also have to make sure that people have access to devices and computers and they know how to use them and that they're accessible. So there are some people with disabilities who find this to be less accessible and some that find it to be more accessible.
Thank you, Sarah. Okay. Any concluding thoughts?
Keep on keeping on.
And a big thank you to all of you for being here today. Just the fact that we have you all in this Zoom room to talk about disparities in Brookline, that is part of making progress on actually remedying these. So thank you so much for being here and for sharing this report, talking about it with your neighbors, and making sure that it is implemented as we go into Springtown meeting.
Yes, thank you everybody for joining us today, and feel free to reach out. Okay, I'm going to end the meeting. Thank you, everybody. Have a wonderful, wonderful rest of the day.
Good luck to you, Mama, too.
Hey, thanks, Rita.
Too.
Bye-bye.